So, my name is Siddhartha. I'm a physician, medical director at Emerald Physicians. And on behalf of Cape Cod Healthcare and Emerald Physicians, I would like to welcome you all for this Wellness Trails event. This is an ongoing series of educational events that we started doing in 2017. And we do a variety of educational topics that are relevant to your health. And the last year, we did a lot of surveys to listen to your ideas, your needs, with regard to what type of topics you would like to hear about. And based on that input, we have co-designed with you this year's topic. So, and out of that, today's topic includes discussion about skin health, prevention of skin cancers, and discussion about eye health and vision and hearing. So 3 important topics will be discussed today. We have a fabulous list of speakers to discuss and share their wisdom with you. And we will also have a nutrition cooking demo and education at the end of it that is relevant to the topics of today. And we will be sending out a survey again for at the end of this session, and we would like to hear your input, feedback, so that we can know how to make this better in the next sessions that we do. And Julie Bado, who's here, can you say Julie does coordinate these events for us. And if you have any questions, any logistical questions, you can always approach Julie at the end of the session to ask her those questions. A few housekeeping notes. The restrooms are right across from the main entrance door that you came through. There are some snacks and water you can enjoy. And for questions that you have for the speakers, I would ask to keep those questions until the end of the speaker's speech, so that you can ask those questions after the speaker is finished with the presentation. And you have in your handout, you have some. You can also take notes using the pen and paper you have, so that you can jot down questions that comes to your mind in the middle of the talk, and you can use I can ask at the end of the talk those questions. All right. So without further ado, we'll start with our first session. We have Dr. Rosemara Huart. Dr. Huart is a board-certified dermatologist with Cape Cod Healthcare. She attended medical school at the University of Iowa and completed her residency in dermatology at the University of Illinois at Chicago. She also completed a research fellowship at Northwestern University. And Dr. Huart sees patients at the Rose Center for Medical and Aesthetic Dermatology in Hyannis. Today, she will discuss skin cancer awareness and prevention strategies. And without further ado, Dr. Huart. Thank you.
Hello, everyone. Thank you all for coming here through this lovely weather and allowing me to talk about something that I hold dear to my heart, that I've put a lot of efforts into learning over the years. So I think it's very important. I came out here about a year and a half ago from Chicago, and can you hear me a little better now? I'm mic'd up right now. Is it? It's better just to use that. Okay. Do I have both? No? Better? Okay. Unfortunately, I don't have a loud enough voice without this. So I moved here from Chicago about a year and a half ago to practice. and I was not sure what I was getting myself into. I didn't realize how underserved the area is, and I've been completely overwhelmed. There's a lot of skin cancer out here and a lot of people who need derm care and a shortage of dermatologists, so I'm glad to be here. So starting off, we're going to talk today about skin cancer awareness and prevention. So here you can see just a little collage of photos, all different types of skin cancers. The three main types of skin cancers are all represented here. So as you can see, they present in a lot of different ways with different clinical presentations. So I'd like to start with a few skin cancer facts. This is from the Skin Cancer Foundation. So 1 in 5 Americans will develop skin cancer in the course of a lifetime. 1 person dies of melanoma every hour. Nearly half of Americans who live to age 65 will have skin cancer at least once. And your risk of developing melanoma doubles if you have had more than 5 sunburns. So regular daily use of SPF 15, and nowadays we really say SPF 30 or more, reduces your risk of melanoma by over half. So people who first use tanning beds before the age of 35 increase their risk for melanoma by 75%. And we still have a lot of states where people under 18 can still go into a tanning bed without a consent. Okay, so I'd like to talk about the main 3 types of skin cancer, starting with the most common and going to the more rare ones. So the most common is basal cell carcinoma. There is more than 4 million cases per year in the US diagnosed every year. 1 in 3 new skin cancers are basal cell carcinoma. It originates from the deepest layer of the epidermis, which is the top layer of the skin. So it's still a fairly superficial area that it originates from. It's also a very slow-growing cancer and indolent, but over time it can really affect the area locally. It can invade into the muscle and into the bone. And if it's near a vital area like the eye, you could even have loss of your eyesight. So you really do want to take care of these when they pop up. So anything that's not healing on your skin, enlarging, symptomatic, you really want to have someone look at it as soon as possible. So these are commonly found on sun-exposed areas of the body. And they often start as just a skin-colored little bump, so they can look like something not to worry about. But if it persists and is new, you should have it looked at. Over time, it can start to bleed and ulcerate, so that's also another sign of a basal carcinoma. And there are superficial forms of this that really just look like a little pink patch on the skin. So even just any pink patch on the skin, you should really have looked at if it's persistent. Okay, moving on to the second most common form of skin cancer. The squamous cell carcinoma is second most common. Over 1 million cases in the US diagnosed yearly. Almost 9,000 deaths from squamous cell carcinoma are yearly, and it keeps increasing over time dramatically. So although it's less common, it is a more aggressive form of skin cancer, and if it's neglected, it can spread internally and even cause death in some cases. It's also more common on sun-exposed areas, and it also has a superficial form that can just look like a non-healing pink area on the skin that's flat. So here are some other pictures of squamous cell carcinoma. As you can see, it can present in many different ways. So of the 2 cancers I've already mentioned, there's many different treatment options. If you catch it early or if it's a superficial form, oftentimes you can get away with a chemo cream or a scrape and cauterize procedure. Depending on the subtype, though, you may have to have it removed with stitches or Mohs surgery. Okay, moving on to melanoma. Although this is one of the more rare forms of skin cancer, it is increasingly prevalent and it can be deadly. So it is the most dangerous form of skin cancer. It often resembles moles or just small brown spots, and we have over 87,000 new cases yearly in the US and 10,000 deaths per year. It's more common in men, and your lifetime risk is approximately 2.2%. And it can be present almost anywhere on the body, not just sun-exposed areas. You can find it under the nail beds, you can find it on your soles of your feet, in the mouth, all different areas. So be sure to do your self-checks at home and look everywhere. It's very unpredictable cancer, and it must be taken very seriously. And as with basal and squam, there is a spectrum of different subtypes, from less severe to more severe, with melanoma in situ being a stage 0 melanoma with less chance of metastasis, and if you catch it early, the chances of it spreading are very low. So this is the common thing you probably have seen before, the ABCDs, and more recently they added E to this. So for the A, you want to look for moles or brown spots that are asymmetrical. Most normal moles are symmetric. You want to look for the borders being irregular, for different colors, so you can have pink, different shades of browns, and then the diameter, anything that's larger than the size of a pencil eraser. And the most important and newer thing they've added recently is evolving. So doing your monthly self-checks is very important because only you will know the evolution of your moles and whether they're changing over time, if they're becoming symptomatic when they didn't used to be, etc. So if you go to the Skin Cancer Foundation website, they have all kinds of tips on how to do your self-checks at home, even without the help of someone else. Okay, next, you want to know your risks. This is for all skin types, but especially for melanoma. So your skin type puts you at higher risk. For example, if you're a Fitzpatrick skin type 1, where you burn always and never tan, lighter skin and blue eyes or blonde or red hair, you're much higher risk for getting melanoma over time. If you have a first-degree family member with melanoma, your risk is 50% higher. The cumulative amount of sun exposure over the years, so even small amounts every day, adds up to increase your risk. Tanning bed use is a significant risk factor. If you've had a prior skin cancer, you're much more prone to getting more. And those of you who might be immunosuppressed are much higher risk. So people who might be on an anti-rejection medicine for after a transplant, or on prednisone or other steroids, people who have underwent chemotherapy, or if you have a history of radiation therapy in the past. And there are other risk factors. Okay, so let's talk a little bit about ultraviolet light. So it's divided into 3 different areas. So the UVC, B, and A. UVC does not pass through the ozone layer, so you don't really have to worry about it much. UV light is at its greatest on the Earth's surface when the sun is vertically overhead. And as you can see in the little diagram here, as you go to the right, the wavelength becomes shorter, the frequency becomes higher, and it has more energy. So UVB is a stronger wavelength than UVA. So what is the difference? UVA is a longer wavelength, and it accounts for a larger percentage of the UV rays hitting the Earth. It penetrates also deeper into the skin than UVB, but it plays a major role in aging, wrinkling, and also forming new skin cancers. And UV is still present when it's cloudy, just to a lesser degree. So UVA can be 30 to 50 times more prevalent than UVB, and UVA can also penetrate glass and clouds. UVB is blocked by glass. So we often think of UVB as the burning rays and UVA as the aging rays. Okay, so how to protect your skin. Some of this may seem like common sense. So seek shade, especially between the hours of 10 and 4. Do not burn. But I also like to say do not tan, because there is no such thing as a healthy tan. Base tans does not mean a good thing. Avoid tanning and UV tanning booths as well. cover up with clothing, and that's going to be your first line of defense. Also wearing a wide brim hat, using sunglasses that protect you from UV, and then wearing a broad spectrum sunscreen. So broad spectrum meaning it covers both A and B rays. And you want to apply a significant amount, which I'll go over the amount that you need to apply in just a few minutes. So, and then also, if you have grandkids around or children, you want to keep them out of the sun until they're 6 months old, and then apply sunscreen after that. And then examine your skin every month, like we talked about, and see your physician yearly for a skin check. So as I was saying, clothing is your first line of defense. You want to wear a wide-brimmed hat, which wide brim, we mean 3 inches or more. A visor, if you're out doing real active activities, might be a good option, but you want to make sure that you're also protecting the scalp and the ears, which are commonly neglected areas, and either putting sunscreen or some way to block the sun from them. Also with golfing, you can get a sunshade for your golf cart. It kind of blocks the sun from coming into the sides partially in the back, which is a nice idea. I know a lot of people golf out here. So remember again, the UV does penetrate through the clouds and through the haze. And you can also get clothing now with UPF in it, which is a UV protection factor for clothing. It's like SPF for clothing. There's Coolie Bar, Athleta. There's a lot of other brands as well that you can find these clothing at. Protecting your eyes with sunglasses that protect from UV, because not only can UV cause problems with skin cancers around the eyes, it can also cause other problems like macular degeneration and cataracts over time. Okay, so this is a fairly dramatic photo that's been published years ago in the New England Journal of Medicine. As you can see, the left side of the face is much more photo damaged and aged dramatically compared to the other side. So this guy was a truck driver his whole life, and as you can see, just getting sun through the window can really cause a big difference. Okay, so what do you want to do about that? So when you think of windows, you want to think about them in your car, at home, and at work. So the glass blocks the UVB, but it doesn't block the UVA, which are aging rays, but they can also cause skin cancer. So if you're in your car, the windshield up front will block the UVA for the most part, but on the sides and back windows, it doesn't block it, or only partially blocks it. So you can have your windows treated with UV blocking film. 3M is a company that does this, but there are others as well. So not only if you do it at home will it decrease your energy bill, but it's also going to decrease fading of furniture and upholstery, etc. So, and protect you all at the same time. Okay, so what type of sunscreen should you get? There's a lot of different brands out there, and it can be pretty confusing. So we want to start by looking at the SPF on the bottle. So the sun protection factor, which only applies to UVB rays. It doesn't tell you if you're being protected from UVA. It's a ratio of how much time it takes to get a sunburn on your bare skin versus when you have sunscreen applied. So for example, with SPF 15, if it takes someone 5 minutes to burn without the sunscreen on, it would take 75 minutes to burn with the SPF on. And that's only if you're applying the right amount of sunscreen. So in the studies, it was quite a bit that they use, and most people in real life don't apply that much to their skin. So I'll show you how much to put here. So a full shot glass for the whole body is the amount they use in the studies. And if you're just covering your face and neck, you would want to put a teaspoon amount, or about a half a teaspoon. So it's much more than what most people use. Okay, so SPF in terms of percentages. So a 15 will block 93% of UVB rays. 30 blocks 97%. So SPF 30 is not double the protection of SPF 15. It's just a small amount improved. We do recommend at least 30, and then SPF 50 would block 98%. So how do you select your sunscreen? So you want to find one that says broad spectrum. That is the indicator you want to see that it's covering UVA rays as well as UVB. And nowadays, most of them are broad spectrum. So as you saw in that picture, UVA that comes through the side of the window can cause photoaging and skin cancers over time. So just as important to protect from that as UVB. You want SPF 30 or higher, and you want your sunscreen to be water resistant, depending on what you're using it for. If you're going to be sweating at all, you want water resistant, or if you're getting in the water. So they're no longer allowed to say waterproof or sweat proof, because that's false. They really are just resistant. So if you are in the water, you probably want to reapply after you get out of the water. You also want to apply 15 to 30 minutes before you leave the house, and reapply it often. So if you go to the Skin Cancer Foundation site, you can actually search by sunscreens. You can search by other products as well and see if they've earned this seal of approval. So if you look on the top here, you have the top two are sunscreen seals. So the top one is for daily use sunscreens, and the middle one is for active sunscreens, so more waterproof, or I should say water resistant. And then the bottom one is for other products like the films that you can get for your cars. So you can look on their site and you can search for the products that meet their specifications. So take-home messages from today. You want to look at your skin monthly. You can look on that website to see a video of how to do this, how to check every area. Know your risk factors. Get a yearly skin check. If you see something you aren't sure about, have someone check it out. Protect your skin, and then enjoy the sun, but be safe in it. That's all I have today. Does anyone have any questions? Yeah, so there are a lot of people concerned that they won't get enough vitamin D, but most people don't apply their sunscreen in the ways that they did in the studies. And so you are getting some vitamin D. They have done studies that showed people who use placebo versus sunscreen every day, and their levels were similar with vitamin D. So unless you're completely blocking yourself from the sun, you should be getting enough, and you can also supplement in your diet. Yes.
Sure. Suntan lotions, they come with expiration dates, but these days you're not sure what they really mean. Is there
Right.
a point at which you really should discard the sunscreen and purchase a new one?
It's a good question and applies to a lot of medicines as well. They still work somewhat after the expiration, but I can't tell you to use them after that date. We don't know for sure. They probably still have some, they work some, but they don't work completely as well. So over time, they will lose efficacy. So.
The type of cloth fiber that's more effective regardless of any special coating, artificial or natural fibers, is there a difference there?
So the tighter the weave is the better, but in the summertime it can be warm to wear these really tight knit weaves. So there are even things you can wash your clothing with that will add to the UPF factor for the clothing. You just wash them with the normal clothing and they protect you better. So, but there are brands like Coolie Bar with the UPF that have very light material that still protect you from the sun.
Do you have any thoughts as to why some of these cancers are so rapidly increasing overall?
Overall, I think that maybe the sun has intensified some, but also just we have an aging population who has had a lot of sun exposure throughout their life, and so the prevalence may be increasing, but there are a lot of factors, so it's a difficult question to answer.
Are Consumer Reports guidelines reliable?
It's a good question. I would probably go with the Skin Cancer Foundation and look at their site to see what they recommend, because they base it all on the studies that were done for the sunscreens. Sorry, she's just.
Is there a level of vitamin D3 supplements that is beneficial for skin health?
So the recommended is, I believe, 600. It depends on the age group, but I believe in the most of the population here today, it's probably around 600 to 800 per day. I believe, and don't quote me on this, I think it's 600 to 800 per day, but most people get enough through the sun exposure and through their diet. We can ask our nutritionist here in a minute. Yes.
In my experience, finding a dermatologist on the Cape is not easy unless you have a serious issue.
Yes.
Is there a dermatology practice that will take patients for yearly checkups?
Right now, I actually am not sure. I know we just stopped taking new patients, but we may start again soon. I'd like to recruit another dermatologist to our practice, but it's a little difficult on the Cape. So you'll have to check around. I know there are several that are not taking new patients.
If you have a lot of skin allergies, what is the best SPF product to use?
I would say if you have a lot of allergies, to go with physical blockers rather than chemical blockers. So that would be zinc oxide or titanium dioxide products that are less likely to cause allergic reactions.
Can you tell me if we call them age spots, are they related to sun damage?
If they are the lentiginous, the true sunspots or age spots, they are related to sun exposure and probably some genetics as well. And some sunspots can become melanoma, just a aside. So if you have one that's changing, have it checked.
At one time, years ago, as the numbers started to go up as far as SPF was concerned, there was also an issue discussed at that time about nanoparticulates being used in it and the chances that that may cause other problems. I wonder if you had an opinion on that.
About what being used in it? Sorry.
Nanoparticulates,
Oh, yeah.
small pieces of aluminum going into your pores.
So there are nanoparticles. They don't believe that enough of it goes into the blood system to cause problems. So you could try the nanoparticles, but there's micro, nano. There's different spectrums of how small they make the particles. So the reason they make them smaller is so that they don't leave the white kind of geisha look on the face, but there are some that are in the middle that won't actually be absorbed into the skin. You can laser sunspots, absolutely. As long as they're not suspicious.
I wanted to ask about the chemical removal of skin cancer without any testing before and after. How reliable is that?
We generally would perform a biopsy first because only some subtypes are amenable to that treatment. And if you use a chemical cream on a more invasive skin cancer, it delays the treatment and most likely won't work. It's hard to prevent when you have that extra risk factor, but just being extra cautious in the sun. There is a supplement that some people take called HelioCare, and that's an internal antioxidant. It's about $30 at Walgreens, And they have some good studies on it, showing that it's an additional protecting factor. It's a fern extract. It's a fern from South America that had to learn how to live on land from water, and so it has had to protect itself from the sun, and so they think that helps.
Some of the skin, protectants or whatever, for instance, for scalp, cost an enormous amount of money. And could you comment on some of these either cancer preventatives or cancer reparatives, let's see, in terms of the scalp application?
And are you talking about the chemo creams? Yeah. So unfortunately, the pharmaceutical companies have raised prices consistently of all the chemo creams, including photodynamic therapy, every single year. And so it's a huge problem that these medications are being, increasingly more difficult to obtain. So unfortunately, there's nothing I can do about that, but hopefully it is something that will be addressed soon. Thank you very much.
Thank you, Dr. Huart. That was a lot of very interesting and useful tips there. It was good to know about the need for a broad spectrum sunscreen that covers both the UVA and UVBs. And also, I think the way that Dr. Huart underscored the importance of having a low threshold to notify your doctor if you notice some changes in the skin, because the skin cancer can present in many different ways, and it may look innocent. So it's good to have a low threshold to notify the docs, I think. So those are points that I found very useful. And I have a question for you all to think about, just to ponder over while we go on to the next talk. So we know that solar rays, sun rays, are very potent and powerful and damaging to the cells. And the damage to cells leads to cancer. And we also know that plants, leaves, are much more exposed to sun than you and I are, right? They are exposed when the sun is up until the sun is down, because they depend on sun to produce the food, photosynthesis. The question for us is, why does the leaves don't get damaged? Why don't they get cancer, right? So think about it while we move on to the next speaker, and we'll come back to that question.